The University of Saskatchewan's College of Medicine is known as a leader in many areas, and now it hopes to also become a leader in Indigenous healthcare. Preparations are underway for the implementation of an Indigenous Health Division, and Dr. Veronica McKinney is the chair of the Indigenous Health Committee at the college and heavily involved in the process. She joins me now. Thanks for being here.
Hi, thanks for having me.
Tell us about this new division. What is its intention?
Well, I think the intention is to really have more focused attention towards Indigenous health and to be able to better support students, to better support our faculty and staff, but also to have more focused attention towards curriculum and research, and to be able to do better both by our communities and by our students as well, in making sure that they have the education they need to be able to work in communities.
How is Indigenous approach to healthcare different than a Eurocentric one?
Well, I guess when you think about traditional ways of approaching healthcare, it's from an Indigenous point of view. First off, we're all very diverse communities, so every community is a bit different. But one thing that's fairly common across our nation is the connection to land and the more holistic approach to healthcare, and the fact that it's an everyday thing that you're doing, whether that's via ceremony, whether that's what you're eating, how you're living your life, how connected you are, both to other people and to the land. Whereas in our medical way of looking at things, it's much more linear. It's much more about trying to find a problem and solve the problem, and hopefully then it goes away or we're able to manage it. So it's a much more broad perspective of looking at healthcare for sure, and one that I think will work well. In my experience, has worked well for all peoples, to be honest. But I think part of this division is not so much to make people be able to practice Indigenous medicine, but to better be able to appreciate and work with Indigenous people and support them in whatever way of healthcare they want to approach, for sure.
Why was it important for you to be involved in the creation of this?
Well, I've worked in the healthcare field for over 25 years now, for sure, and both in my positions, but as my watching my family members, the experiences that I've had. We all know that there is a tremendous amount of racism and oppression within the healthcare system. There's been numerous research that's showing the same thing. And we know that there are Indigenous and non-Indigenous people who are witnessing this in both healthcare roles and otherwise. But the challenge is people don't know how to approach it. And I think at this point in time, what we're really seeing and hearing is that our students are still experiencing the same things that even I experienced as a student back, I kind of tease 100 years ago when I was taking medicine. And so I think everybody wants to do better. We're much more aware now of what some of the issues are. I think, the hunger is there from the students' point of view and from the faculty point of view to learn and to do better and to know what to do so that we're actually looking at the system and how we can change the system to stop these inequities, which ultimately I think will lead to better healthcare for all as well.
I think you've kind of touched on this already, but this division is open to everyone, not just Indigenous students. Why is that important?
Well, I think, part of the Truth and Reconciliation talks about this, that we have to work together to make this work. And I think, to be honest, again, as I've sort of said, like there are a lot of people who want to do better, whether those are Indigenous people or non-Indigenous people. And so we take all comers and we want to work with those that are interested in helping and making a change. But also who are going to walk the walk, not just the talk. But also, it's interesting from a traditional point of view, our elders tell us this, there are petroglyph teachings, and what they teach us is that we must all come together, whether we're Indigenous or not, all the different nations, and work together to get through the challenges that we all face. And ultimately, as I said, these challenges will have effects on all of us. So, it behooves us all to work together on this. I think at the University of Saskatchewan, we certainly are leaders in many ways. We have some of the highest numbers of students that are entering and completing medical school as Indigenous students. And we certainly have great scholars, not only within our college, but throughout our campus. So, and our population is such that we have a very high Indigenous population. In fact, in the north of our province, we have a population greater than 85%, which is higher than Yukon, it's higher than the territories, it's even higher than Nunavut, but a lot of diversity within our communities. So we we have an opportunity to really put something into place. And through Northern Medical Services, which is a division within our college, we can actually put into practice what we're teaching within the college. So, it's a very unique opportunity and one that many don't see even internationally.
Thank you so much for your time, Dr. McKinney.
Thank you. Take care.